You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, and today we are joined by ONS member Marcia Beck, Clinical Nurse Coordinator of Lymphedema Prevention Risk Reduction Clinic at the University of Kansas Health System in Kansas City, Kansas, and member of the ONS Greater Kansas City chapter. Marcia was also part of the panel that developed the ONS Guidelines for lymphedema, which were published in September 2020. Thanks for joining me today, Marcia.
Thanks for having me.
So to start us off today, what is lymphedema?
Lymphedema is an accumulation of lymphatic fluid that can cause swelling. Usually it's secondary to a cancer type surgery where lymph nodes are removed, or it could be because of malformations of the lymphatic system.
So as a healthcare provider, can you tell us what patients are at risk for experiencing this, or how to identify those patients that are at risk?
Certainly patients that have had surgical procedures for cancer, really anywhere throughout their body that has required lymph node removal for staging of their cancer, are going to be at risk depending on the number of lymph nodes that have been removed. Some ways that we could identify patients is certainly reviewing patient histories. Patients are going to be at risk throughout their lifespan. So if a physician and nurse are reviewing a patient, check to see about, have they had cancer? What are some of their surgical procedures? That would be very helpful in identifying patients that are at risk for developing lymphedema.
Is there a lifetime risk for lymphedema for these patients?
Patients that have had what we call sentinel lymph nodes, they've only removed the nodes that are closest to the tumor. The lifetime risk of developing lymphedema nationwide is probably about 6 to 10%. For those patients that have had further lymph node removal, in breast cancer, the axillary lymph node dissection, where they remove more lymph nodes, the risk for developing lymphedema in their lifetime could be as much as 20 to 40%.
In these patients who are experiencing lymphedema, what are some of the challenges that they are experiencing?
Unfortunately, treatment for lymphedema has only been available in the United States since the late 1980s, and that certainly includes lack of education within our medical system as well. So sometimes the challenge for patients is just getting their problem recognized. Why do I have this swelling? What can I do to prevent it? So as we are working toward earlier identification, some of the problems that the patients have had could be ongoing swelling, increased infections, a reduced quality of life that might lead them to social isolation because they don't want to go out in public with this greatly enlarged arm or leg.
So when we're talking about, in a very interesting piece that I noticed in your title is prevention of risk with lymphedema. So when we're talking about something like that, what are some things that oncology nurses can do that is looking at prevention or early diagnosis with these patients?
I don't know that we can say we can prevent all causes of lymphedema, but certainly reducing that risk can lead to not developing later symptoms that can create difficulties for the patients. So prospective surveillance is what we've talked about, and currently that can vary from institution to institution, but usually it includes taking measurements of the extremity, providing education about risk reduction practices for lymphedema, the benefits of exercise, and some of the symptoms that they might need to call their provider earlier if they notice signs and symptoms.
So do you see patients that might be hesitant about letting their providers know if they're having these kinds of symptoms or noticing something, and maybe if there's something that the nurses can do to help patients overcome that, to help us in that early diagnosis of lymphedema?
Well, I think it starts with those earliest visits, even preoperatively, providing the opportunity to identify here are some possible complications and educational information to help reduce that, or when to call so that we can refer you to the proper treatment or get you the answers that you require.
What are some misconceptions about lymphedema and treatment options for the condition?
Often, I think there's denial among all of us. Surgery doesn't cause lymphedema. Radiation doesn't cause lymphedema. I don't have that much swelling. These are all misconceptions, and we all need to work together to provide that. Or another misconception is, oh, I've been cancer-free for 5 years, so I don't have to worry about lymphedema any longer. That's a misconception because our lymph nodes do not regenerate. So we carry the risk for developing lymphedema throughout our lifetime. There's not a magical number of months or number of years, and then we no longer have to be concerned.
That's interesting to know. So would you say that it's very important that the nurses let patients know that and educate the patients on this, because it could happen at any time in their cancer journey?
Yes, I definitely agree with that. When we are educating our patients at the University of Kansas Health System, we talk to them about early risk management, like maintaining an intact skin, not allowing needle sticks or venipunctures on the affected extremity. And we talk to them about making that just a new normal. There's not a lot of research regarding these risk reduction practices because it really wouldn't be too ethical to take some patients and say, okay, I'm going to draw blood from your affected arm for 25 times and see if you develop lymphedema. It's just not an ethical procedure. So we recommend that this just be a part of their new normal in their life with surgery and lymphedema.
So Marcia, the ONS guidelines recommend prospective surveillance. Can you tell us, what does that entail?
Well, certainly prospective surveillance is an early identification, and it can vary from institution or practice to practice, but generally it includes taking limb volume measurements of the affected extremity. It can also include risk reduction information for the patients, benefits of exercise. Oftentimes they're fearful of doing exercise for fear of damaging an incision or something like that. Symptom management, should they notice an early sign like aching. These are all can be provided quickly by nurses in the field once it's established as prospective surveillance.
Is that something that was a routine part of follow-up for the patients at your center, or is that something that you had to work into just the standard routine follow-up with patients at risk?
I've worked in a couple of different areas and worked hard to try to provide prospective surveillance. The program I'm currently with, University of Kansas Health System, it's built into their breast cancer clinics and treatment of their patients. It's just automatically a part that they get a visit with one of the lymphedema nurses, or we do a follow-up measurement to see how and if if our measurement is increased a little bit, then a visit about, have there been different activities? Have you experienced this? And try to offer some simple interventions. It might be as simple as, let's have you wear a compression sleeve for every day for a month and see if that helps reduce this congestion. There are different ways, but it is an integral part of our program, and I'm very thankful for that.
Would you have any recommendations, or do the guidelines have recommendations to help people put that into their routine follow-up for at-risk patients?
We do suggest that they provide that, and current standards, providing evidence-based risk reduction, symptom management education for those patients really before they have surgery. So preoperatively is the minimum we would expect. Certainly, taking measurements would be appropriate. There are now some instruments that can be helpful with that. Research institutions, for instance, have had pyrometers that basically you just apply your extremity and a kind of a electronic recording of the measurements takes place. There are other bioimpedance type instruments that are helpful in identifying changes in the lymphatic flow. So those instruments could also be of value in the clinic settings.
So something that is considered standard therapy for patients is complete decongestive therapy. How would you define that therapy?
Complete decongestive therapy is a 4-part treatment for lymphedema that has presented perhaps beyond what prospective surveillance can handle. So there is a little bit of swelling, or there's some controversy about what constitutes it, whether it's a 2% increase or 250 milliliters greater than the previous measurement. So there is a little controversy there, but it consists of 4 parts. So manual lymphatic drainage, which is not a massage, but it is a technique to redirect lymphatic fluid from a congested area to an adjacent quadrant so that there is better flow of the lymphatics. The second part is compression therapy, which in treatment for lymphedema is a short stretch bandages with padding that kind of make the extremity look like a trunk and even it out. And that's worn for almost 24 hours a day. The third part would be skin care. As we discussed, are lying underneath the skin, just on top of the muscles. So any breaks in the skin are a portal of entry for bacteria. We want to maintain an intact skin to prevent infections. So low pH or neutral pH lotions are good to use for patients that are experiencing lymphedema. The fourth part of that would be exercise. We encourage exercise, particularly when they have that compression bandaging in place, because the bandaging is supporting the skin, not allowing any other fluid to accumulate. So it only can go up and out the channels that have been established through that manual lymph drainage.
The guidelines definitely recommend adding an active treatment to complete decongestive therapy with patients. So what can you tell us a little bit more about this, such as, like you just mentioned, the manual lymphatic drainage or compression pumps, but also yoga exercises and things like that?
I'm not a big fan of compression pumps at this period. The compression bandaging is more what I'm referring to. And the exercise is vital to help moving the fluid out. A very effective exercise for any patients really are water therapy. The water provides additional compression. So water aerobics or activities where water is supporting the extremity, again, helps move that lymphatic fluid. So I do think exercise is a big, important part of that. We often forget even how deep breathing affects our muscles and lymphatics. So deep breathing is very effective, and it really can help lower extremity lymphedema because as the diaphragm comes down and presses on the thoracic duct, which is carrying the lymphatic fluid, it actually provides a suction effect to improve the flow of the lymphatics at that time. So slow, deep breathing throughout the day helps relax muscles, helps reduce stress, and it's helpful for the lymphatic system as well.
Okay, thank you on that. I think that's really important because it's probably, like you said, not only is it good for the lymphatic system, but it's good for patients just in their well-being. And a lot of what we're talking about too, when you mentioned the exercise and things, those are all such good things for patients to be incorporating into their cancer journey, their treatment plan, and things like that to help them not only with this side effect, but with many other side effects or issues that come up with receiving cancer treatment. So, as a nurse, when you're taking care of patients who are actively dealing with lymphedema or could be at risk, what do we need to keep in mind when drawing blood or taking blood pressures with patients? And can that be done in a lymphedema affected arm?
Again, there's not clear research about that, but common sense and expert opinion is the fewer times that we have to break the skin on the affected extremity, the less likely we could introduce infection. So just from that common sense area, we certainly recommend that you use an unaffected extremity to draw blood, have vena punctures and things like that. Now, we know there are patients that have had bilateral cancer. Perhaps they've had a arm with axillary node dissection a few years ago, and now this year the opposite side required sentinel lymph node biopsies. We recommend that you draw blood from the extremity that had the fewest lymph nodes removed. Also remembering that many things that would break the skin, like injections or flu shots, things like that, could be given in the hip area, in the gluteus area. So there are alternatives to injections in the affected extremities.
Those are some really good points because I think that as we get into routine with things, we can just automatically think, oh, well, it's just their Neupogen injection or something like that, and don't think of a different location to administer that. But not only for us as providers, but I think it's so important, as we've said earlier, about educating the patient on those pieces and that information and what's so important for them, that they understand and they know that they can be advocates for themselves and tell people that when they go to have their flu shot, please make sure, I have this side effect from my therapy, from my surgery. Can you please administer my shot in my hip or my flu vaccine or whatever that might be? And I think that's really important that we give our patients the empowerment to know and to be able to talk about that. And like you said, also when you have a patient that has had it done bilaterally, maybe letting them know and giving them the tools to know that, yes, my right arm only had fewer number of lymph nodes removed. So that would be the better arm if we had to pick one of the two to do whatever that needed to be.
Yes, I agree.
Can you talk about the importance of having a certified lymphedema therapist for treatment?
Absolutely. When we are faced with illness, we try to find our healthcare providers that have the highest level of expertise, whether it be a surgeon or a specialist in internal medicine, that sort of thing. So when treating lymphedema patients, it's really important to consider a lymphedema therapist that is certified. And there are different levels of certification, but what we recommend is a therapist that has taken a minimum of 135 hours additional training and then hands-on learning to know how to treat lymphedema patients. We don't get this kind of training in our nursing programs, in our physical therapy programs or occupational programs. This is an additional program that is needed for training. So the Lymphatic Association of North America provides this training and provides a competency certification exam that is voluntary for the therapist to take. But it shows that commitment to continuing education, to excellence in providing care, professional growth through obtaining that certification. We highly recommend that.
I'm sure that is an important part, just to have that certification and just that added knowledge like you were mentioning. What is something about lymphedema that's not often discussed, but you wish people knew more about?
Just general knowledge of lymphedema, I wish people knew more about. We do hear more about it at present, but I think it's important to know that there are activist groups that are working to try to provide better insurance coverage for the treatment of lymphedema. That has been very spotty throughout our country. I think it is important to know that internationally there are groups trying to standardize care and provide additional care to countries that may not be able to handle that themselves. So the International Lymphedema Framework was established in England in the early 2000s, and we followed that here in the United States with the American Lymphedema Framework Project, whose purpose is to increase the educational information and help support worldwide treatment.
I think that is great, as like you were saying, with the international, just to get that access out there and the education and awareness for patients that may not have the same type of resources that we have here in the United States. What are some of the resources for oncology nurses who want to learn more about lymphedema?
Resources for nurses would include our Oncology Nursing Society's information. There are several lymphedema resources available there. The LANA, which is the Lymphology Association of North America, that provides information about therapists and how to obtain certification or what that might require. The Lymphatic Education and Research Network, or LEARN, provides a lot of information about lymphedema. Kind of a grassroots effort in the Lymphedema Treatment Act is currently available that would help provide that information. So there are several websites that oncology nurses can provide, and researching prospective surveillance could give them kind of a plan to promote that in their particular clinics.
Are those websites good resources for patients, or are there specific patient-centered resources that are available and out there that we can direct our patients to?
Well, the Lymphedema Treatment Act would probably be good for patients, but more patient-centered resources might be the American Cancer Society, and they have information about lymphedema. The Komen Foundation has evidence-based information regarding lymphedema. So those would be resources for patients.
So as we wrap things up today, do you have any final comments about lymphedema or any of the other things that we discussed today in the treatment or the surveillance for patients that you would like to share with our audience?
I just think that surveillance is very important for patients. And so sometimes when you get that new diagnosis, you are just totally overwhelmed with all the components that are there. But by providing resources, a little handout, pamphlet, email to the patients as they are recovering, they go, oh, yeah, this lymphedema stuff, what was that about? I think the earlier we provide information, then the earlier we'll be able to detect changes in the lymphatic system or heaviness in the arm that they hadn't thought about before. Important signs that will help lymphedema from progressing to a later stage.
I just want to thank you for your time today and sharing with us about the new ONS guidelines for lymphedema and for being part of that wonderful project. So thank you, Marcia.
It's been my privilege to be able to participate.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.